elective surgery, they just get it done quicker. And they get it done and they're in a private room. It's not like they have a different type of care. Very often they'll be treated in the private ward in an NHS hospital. Just to give you an example of this, there is no private ER in the whole of this country. The nearest we have is an urgent care centre in central London, and it closes at midnight and it reopens again at 6 a.m. in the morning. So I don't know if anyone has told him yet, but the care plan for your president, if he comes to visit here and something really seriously happens to him, is the same as every other US president's visited. He will be taken to St Thomas's Hospital, where you visited just the other day. You got a lovely view of the Houses of Parliament, but he'd have to have a little taste of socialised medicine. So I don't know how he'd like that. But in certain circumstances, there is no way round our system. And these private hospitals, if you're seriously and critically unwell, you don't want to be in them. Because there aren't doctors in them a lot of the time. Because all the professors of medicine, all the teaching hospitals, all the advanced places of study and research are all NHS. So if you're a really high-performing doctor and you're at the cutting edge, you don't want to work in one of these places. You want to work where all the study's going on. You get an afternoon a week off, or maybe two, where you can do your private practice. But you aren't based in these places. So it's a very, very different system. I think there are downsides. It's not perfect. The big downside is queuing. So my dad, he had a double knee replacement 2 years ago. He was diagnosed. He had to wait a year for the operation. But as he pointed out, he'd been wandering around with this pain for 10 years before he could be bothered to go in and talk about it, and he could always opt to pay for the surgery, $30,000. He said, do I want to pay $30,000 or do I wait a year? He said, I'll wait a year. You know, it's always your choice. So that's how it works. But you don't wait for cancer care. You don't wait on the street if you're in a car accident. I know some of these rumours go around on Fox TV. It's only for the elective stuff that you wait. Critical and urgent care, you are seen on a clinical basis, just as you would be in the US. Okay, question here.
Yeah, so because you have less and less clinicians who are being licensed, because you have these more stringent rules, are the annual fees going up for them?
Okay, well, first of all, we import lots of physicians from around the world. So chances are so we have the largest number of qualified doctors from the Indian subcontinent anywhere apart from India. So the chances are you will have a family doctor that comes from India. I mean, when I grew up like in the really heart of the countryside, all the family doctors in our neighbourhood were from Pakistan or India. So that's been a really long tradition in this country that people came from what we call the Commonwealth and would come to this country to do their training. So I can remember Dr. Dashan and Dr. Patel were the two doctors when I grew up. And I grew up in an area where they were the only people of colour in our area. So they were like, so our association as kids of people of colour were people who were like professionals who came in, who were like the doctors and people who respect. Before that, it had been Polish people who'd come as from before the war. So that's one way we get around that, is by new people, because they want to come and study at our great medical facilities and our teaching hospitals, and then they stay afterwards. And then you talk about fees. We don't pay fees. There are no fees. It's all funded out of general taxation. So there are no fees, there are no insurance premiums. It doesn't work like that. This is a difficult thing for people to get around. There is no fee-based system. So it is free at the point of use, and there is no insurance premium. You don't have an insurer.
You just have to keep the regulations up to maintain your license, but you have no money.
So the patient doesn't pay the doctor anything. The only things you pay for in our system are dental care, and then dental care. If you have an NHS dentist, you know what the cost of everything is. Okay, but then a lot of people go for private dental care because they want the fancy veneers or they want the different coloured fillings and all of that. That's fine. But lots of people are entitled to free dental care because, say, they're on welfare or they're over a certain age or they're pregnant women, so on and so forth. And then medication. So all medication is charged at a flat rate. So it's regardless of how much the medication costs, and the flat rate is, I don't know, it's about £8 per script. The reason I don't know is because I have a long-term health condition. I'm on drugs to control my epilepsy. If you have a long-term health condition, you don't pay. You have a card called a medical exemption certificate, and then all your medication is free. Not just the medication linked to your condition, but everything else, because it's assumed if you have a chronic condition, you may have other conditions coming off it. Anyone over the age of 65 doesn't pay, anyone under the age of 18 doesn't pay for medication, anyone on employment and support doesn't pay for it, pregnant women don't pay for it. So in fact, only 30% of prescriptions are paid for anyway, and those people are paying about $10, regardless of what the medication is. So So they're the only two things, and optical care. So it's a completely different
And
system.
do your health professionals have to have malpractice insurance? If most
So malpractice insurance is through the Medical Defence Union. They nearly all have the same one, but generally speaking, where you have cases of litigation, you're actually suing the NHS. So the NHS, normally this is really complex area because the money deals will be a lot less sometimes than the deals you would get in the States. That's because the ongoing healthcare costs attached to why the awards are made so big in the States sometimes because the person is going to have lifelong conditions. Well, of course, the NHS does is it gives an undertaking to meet all those ongoing healthcare. So what they're doing is they're giving a compensation for the mistake that's made, and I think it's something like 95% of cases never go to court. It's nearly all stuff like that. And there's now an arbitration service to try and avoid litigation in the first instance.
So when you're born, you receive a national insurance number.
No, you receive a national health number, the
National
NHS
health
number.
number.
You get your national insurance number when you're 16, when you become eligible to pay national insurance. And national insurance, so we have two forms of income tax, and then national insurance, which is an additional tax, which is supposed to be hypothecated to pay for the National Health Service and for pensions. So everyone, when they reach the age of 66, I think it is now, you get a pension from the state, which is about $200 a week.
So just like dental care, or you mentioned how dental care is privatized,
Part privatized.
part privatized, is optometry the same way?
Yeah, so optometry and dental care are exactly the same. So they all have NHS signs in, so they have a fixed fee structure, but lots of people are exempted from paying for it.
Okay, because
Lots of employers often also, because of our health and safety regulations, if you work at a VDU screen, we used to call them VDU screens, they call them different stuff now, but if you're working for a screen, your employer is obligated to pay for your optical care.
okay, so like I've seen a lot of like optician shops where like people can buy glasses,
Yeah.
but you mainly go to NHS
So
to
no,
see.
what
your-
happened there is quite complex because they'll have a group of frames which the NHS will cover for, but if you want a fancy frame or stuff, you're going to have to pay for that. So the prescription is for the lens, which is what the NHS will help you with.
Okay.
The frame is your business, you know?
Right.
The frame is a fashion accessory, but there are a group of frames which are covered by the NHS. So people, and they've done a lot of work to improve them. So some of the NHS frames have kind of become kind of geek fashion. So the ones I remember as kids now are really cool. So they've become really geekly fashionable. Question here.
So my question is like typically if you have a medical condition that needs to be monitored,
Yeah.
like would that be handled with NHS only cover that outpatient wise if it's like
That's
something that's
everything,
not-
everything. It's okay, take my epilepsy, which was diagnosed 14 years ago. That covers all my medication. That covers the fact that I go to the hospital, which is world-renowned centre called the National Hospital for Neurology, at 4 monthly appointments where they check, they do all the it includes the nurse coverage, but it also includes if you go for inpatient. So I've been for inpatient tests twice. We go in for telemetry. Everything is covered.
So let me interject with that. So because in our minds we're thinking, okay, it covers everything, but monthly, are you giving something?
No.
Okay.
No. So.
yeah.
So taxation rates are very variable here. So basically, you don't pay any tax on the first $16,000 of income at all. Okay, so no tax. You do pay national insurance above 10,000, which is 10%, but no income tax. Then above that, it's a sliding scale, and the top rate of tax is 45%. Okay, but we do pay sales tax. Now you all might think there's no sales tax in this country because it's not listed, but everything has 20% sales tax on it. Yeah? Yeah? We don't list sales tax because it's universal 20% on nearly everything. If you're not driving cars while you're here, guys, but if you saw the price of our gasoline, you would faint. So things that are harmful or things which are causing harm to the environment are taxed very heavily to encourage you away from those behaviours. So remember how I was mentioning how much cigarettes are taxed? The cost of alcohol when you're buying alcoholic beverages in this country is about 70% of that is taxation. So certain things are very heavily taxed. And it's in the interest of the state to do that because it's funding the healthcare and it's discouraging you from things that are going to lead you to using the healthcare. We're introducing a sugar tax shortly. So sugar's going to carry an additional tax on it, and soft drinks are going to carry an additional tax on them, which have a lot of sugar in them. So you tax different things. The tax rate is variable. So someone on a very low income doesn't pay any income tax. Someone on the top rate of tax is paying about 45%.
And is are your mental health services on par with
So we're
The rest of
moving
your
to
medical
parity
care.
is the phraseology,
Okay.
but it's accessed in exactly the same way and it's all provided by the National Health Service.
Okay, and do you have enough clinicians in that area?
So, okay, I do a whole psychology tour, which I've been doing this week with a group. So as a comparison, direct comparison in figure terms, so you have per 100,000 population 8 psychiatrists, we have 18.
Okay.
Big difference per 100,000 population comes in mental health nurses. So nurses are really crucial to our whole system of medicine here. A lot of things that will be done by people who have fancy titles in your system are done by nurses who have done additional training and advanced themselves in their careers. So we have a whole class of nurses called registered mental nurses, and they are at the front end of delivering mental health care. So they can run things called crisis teams who do intervention. So if someone presents at ER and they're seriously unwell, the first idea is not to put them in a mental health institution, but they can go home and receive 2-hourly or 4-hourly visits at home to do like an ongoing check on them, provide their medication so that they don't have the medication at home. That would all be run by nurses. So you have 3 of these specialist mental health nurses per 100,000. We have 83 per 100,000. So you have a big waiting, and mental health care is weighted towards community provision here. So very few acute mental health hospitals. Where you have acute beds, they are in general hospitals. So you have a mental health ward within a general hospital, or you have what's called specialing, where mental health patients are actually being treated with a one-to-one nurse working with them on a general ward. So it's quite different.
Do you have nurse practitioners?
We have nurse practitioners. We were one of the first countries in the world to introduce nurse practitioners. That's kind of a UK invention that's gone worldwide. And we have nurse consultants as well. We also, another big difference is in midwives. So midwives in this country lead the whole process of labour and childbirth. The chances are, unless you are having a complex birth, you will not see a physician or obstetrician. It's midwives that do the whole thing. They are only obliged, the midwife makes the decision whether to call an obstetrician if she thinks it's a complex birth. So you go to a midwife-led birthing centre, or 20% of people on the NHS decide to have the birth at home. And then there's a midwife in attendance, and they would call an obstetrician out or an ambulance to take the patient in. So nurses have a huge, and of course nurse practitioners prescribe, as midwives can prescribe, and nurse consultants have a very wide prescribing brief. Diabetic care is essentially run and managed by nurses in the UK. So if
Is
you
there
were run-
oversight by physicians? Like
yeah,
we're
so,
nurse practitioners.
oversight, but a lot of independence, yeah. So generally where you have a diabetes clinic, you have several diabetes clinics, and then you'll be attached to a diabetes unit in a hospital, which would be overseen by a physician. But the individual clinics would be led by nurse practitioners. So 34,000 members of the Royal College of Physicians, over 1 million members of the Royal College of Nursing, don't forget here. It's a huge profession. Okay guys, you're not going to get to lunch. I can talk all day and answer your questions. But let's go around and talk about public health and healthcare, because it's not just medical professionals that have helped out over time.